So I want to just say too, we have an amazing sponsor too today who I absolutely love, and it's Breast Support Pillow, and we're going to be doing a prize from Breast Support Pillow. So this is the amazing Breast Support Pillow, the little pillow that goes under your breast to support your breast into the right position. So that it takes the hands away and it makes it more of a hands-free experience. And so many moms have to hold their breast to get good positioning on the breast with the nipple and get the nipple in the baby's mouth. Lisa, just stop moving a little because I can hear the microphone. Sorry. It's all right. We're having all kinds of issues.
Yeah, I just want to untangle them.
Go ahead. You good?
I'm good.
All right, good. So if you want to win the breast support pillow and also a fabulous handout from Lisa, what is the handout, Lisa?
The handout is signs and symptoms of lip and tongue tie in what I consider 3 patients or 3 issues. We have parent issues, we have baby issues, and we have feeding issues. And they're separate from each other, even though they overlap. Yeah. But I like to look at it that way. So it's a handout that explains signs and symptoms to look for.
Fantastic. It's great. And so what I want you guys to do right now, type the word TOTS here in the chat, and I will send you a little message through Messenger where you can click on the link. There you go. Type the word TOTS. Okay. See how handy. Look at me. I'm so fancy.
I love that.
I'm so fancy. Okay. Type the word TOTS and you will get a message from me that will give you the links to enter to win for the breast support pillow. Okay. And also a link to Lisa's website so you can get the handout from Lisa. Okay.
Shari, thanks for sharing that, Shari. And
absolutely.
You know, the other thing that I am developing a teaching tool for parents that will be like an intensive, full scope, all of the things that we're talking about today. So if you sign up for my handout, you'll be on the mailing list to be the first notified for when that's all ready. It's almost all ready. And that's
so great.
All exciting too.
Thank you. Perfect. Okay, good. So there's the word. Okay, I see you guys all got it. All right, so I'm going to turn this off for a minute, and we're going to go ahead and we're going to I'm going to ask you the first question that came through, and this was actually a question that came through into my private group, and it was from Sylvia. She actually gave us a picture of her baby too, so I'm going to put that up here on the screen and ask her question. Hold on. All right, so this is Sylvia's baby, all right, and she said, hi, so my breastfeeding consultant told me that this is not a restrictive lip tie, and that's the picture here. She is gaining weight and eating properly, but she's going to have a gap between her teeth. I looked it up and I found out that if it doesn't run in the family after losing her baby teeth, it's going to correct itself. Is that true?
Well, Sylvia, there's a couple of issues that I would think about, a couple of concerns. Not only, gaining weight isn't necessarily a sign of a good latch, even though that's the end result you want. You haven't mentioned anything about how you're feeling. The other thing I'd be concerned about is that those of us that work with babies that have lip ties find that about 90% also have a tongue tie. And that has possible repercussions beyond breastfeeding too. So I would maybe, looking at a picture is difficult. Maybe your LC saw that this baby's lip works fine when it breastfeeds, because a lot of it is about function and how things work more than what it looks like in a picture. But looking at this picture, I do see some tension around the baby's mouth, the upper lip, the white blanching around it. And we usually like to say that the lip should reach up to here easily, like that. And if there's so much tension there, what else is going on inside? So not necessarily like 100%, I'd say, you better get it done. But I would say maybe look into it a little bit more.
Yeah.
And, I hope that answers the question.
Yeah, definitely. I think it's a really good point. And I think that it's not always just about what you see.
Right.
Because I think so often I'll see the questions come in pictures where they're giving me images like, what do you think? And, they said this wasn't a problem. And are they really evaluating the function of how that baby is sucking, swallowing, all the other things versus just looking at it and saying it's fine.
Right.
It's not a bad.
Yeah, this is definitely a diagnosis of function rather than form. I've often seen babies whose tongues look beautiful, but they're not using them right. Or who look like they're, look better than they act, or some that look really awful. The we'll see later little pictures of anterior ties that is attached really in the front, but the babies are moving fine.
Yeah.
So it's more about function than what it looks like.
Yeah.
That's
absolutely.
why an IBCLC is so important to evaluate it. And
Totally.
I think that, both of us agree that there's lots of lactation help and lots of good work done by all kinds of credentialed lactation workers or breastfeeding helpers or counselors. But when you have an issue like this, it really needs to be the gold standard IBCLC who's evaluating. So
Absolutely.
that's important too.
Absolutely. And I think that a lot of times moms will rely too much on their pediatrician for this evaluation and never take it that step further to get it fully evaluated, where a pediatrician's really not going to be able to evaluate for function the same way. So, so speaking to what Lisa's point was, which is this is really a diagnosis of function. The peds not really going to be able to just look in the baby's mouth and say yes or no, whether it's going to be a problem.
Right. And do you also hear, Shari, like I do, pediatricians that, moms think that because they support breastfeeding, the pediatrician knows how to evaluate breastfeeding. And that may be, in some cases, there are some IBCLCs who are pediatricians, and that's wonderful. But in most cases, the pediatricians don't really know enough about breastfeeding to help with issues like this.
Yep. Absolutely. Absolutely. I always make the analogy that, if your baby, God forbid, had some kind of a special problem, beyond just wellness visits where you're going to the pediatrician, wouldn't you take them to a specialist? Wouldn't you have this evaluated? We work with specialists all the time when you're dealing with any kind of a medical issue or any kind of problem. And breastfeeding issues is an issue that needs to be evaluated by a specialist. Those are IBCLCs. And so you really do want to make sure you're seeing the right person. Okay. The next question, let me just say this too. Anybody who just joined us late, welcome back. And just if anybody wants to join the live stream and ask your question live, I'm going to post this link right here. It actually came through in your link when you typed TOTS so that you could see it there. But if you don't want to leave the chat, you can type bit.ly/live62918. And this is case sensitive. Okay, that will take you right to our live stream right now where you can join the chat. Joe will go ahead and put that into the comments here so that you have it as well. All right, so anybody wants to join us, join us. We'd love to see your face. We'd love to hear your question live. And if you have babies at home, that's a bonus because we love to see babies. All right, so if we want to see babies. Okay, so let's move on to the. Oop, what happened here? Okay, hold on. Oh, all right, there we go. All right, so let's move on to the next question. And also, while I'm asking this question, I think Joe already did you already ask them where they're from?
I did.
Oh,
you can ask.
Okay, I'd like to know where everybody's from.
Me too.
Yeah, do you want to see where everybody's from? So everybody just type, even if you did it already, we missed it. We were talking too much. Just go ahead and type where you're from here in the chat. And if you're new to our live events, I'd like to know if you're new so we can welcome you properly as well. All right, so go ahead and type that. Next question came from Kim, and I feel like this was who was trying to get into the stream here. Kim, are you trying to get into the stream? I think you are. All right, let's see. I'm going to give you a minute to see if you want to come back in, Kim, and ask your question. I'll go on to one other question, then we'll come back. This came from Michelle, and Michelle said, at almost 3 years old, I pointed out my daughter's upper lip tie to the pediatrician, and he told me that the dentist will just clip it, quote unquote. Can you tell me what is expected and how they help little ones through this?
Okay, so the dentist might not clip it unless it's causing a problem at 3 years old. But again, I would look towards if there's a lip tie, is there a tongue tie? And are there any symptoms of that? Which in a 3-year-old, I mean, it's not really my specialty. I specialize in breastfeeding young babies. But what I do know about in older kids is there can be speech issues. Mm-hmm. There can be feeding issues. So look for things like that. The other thing is that in the long run, and this is like way down the line, there can be airway issues. Mm-hmm. If a person has oral restrictions, because the way the tongue develops develops the way the airway develops.
Mm-hmm.
So if there's anything like snoring or sleep apnea, you wouldn't usually see sleep apnea in a 3-year-old, but snoring would be something to look for. So I would start looking for a dentist that understands airway issues, if that's a concern. This 3-year-old may be absolutely fine, and we may be bringing up issues that don't even exist.
Mm-hmm.
But just to be complete in the answer, I would say that. And then if it does need to be released, I would always find a laser dentist, because it's much less traumatic with a laser. Mm-hmm. Pediatric dentists who have laser are not familiar with and comfortable with using lasers. And then the procedure, if it's a lip tie, is not really that big of a deal. It's a very quick office procedure. Mm-hmm. There's not a lot of pain involved, and there's not too many complications.
Mm-hmm. Mm-hmm. Let's talk a little bit about the difference between a laser procedure, because there's really, I think people get really like worried and upset. And how difficult is the laser process, like on a baby?
Okay, so on a baby, the laser procedure is very simple. Takes literally about 5 seconds. The hardest part about the procedure is holding the baby still. So, the same positioning that you'd need to do to hold the baby still to examine is just about what makes them cry, because little babies don't like to be still. Mm-hmm. And then the laser itself, the application is between 10 and 30 seconds total. Mm-hmm. So, and there's the laser, if it's somebody who's proficient in using the laser and they're using the right laser and all that stuff, it controls bleeding, so there's almost no bleeding usually, and it also is cold, so it doesn't produce pain. So, and it just it's done quickly, and it's not a big deal. And if it's done in an office that does this on a regular basis, usually the doctor will have a space for you to go and hold your baby and breastfeed right after, or bottle feed if that's how you're feeding. But that's the usual procedure for a laser.
Right. And so from that, you want to make sure you're choosing the person who does it carefully, and make sure that it's somebody who's doing it frequently and often. Mm-hmm. And then the laser process is probably a lot easier and safer to do than anything else.
Right. Well, the biggest complications whenever you're having any kind of surgery anywhere in the body, the highest complications come from bleeding or infection. Mm-hmm. And both are decreased with laser versus scissor. Mm-hmm. That doesn't mean that there aren't people that know how to use a scissor and do it really well and have very good results. Mm-hmm. So like you said, getting the right person definitely is key. And how do you find the right person? There are lots of support groups on Facebook. I would ask around, definitely the IBCLC in your neighborhood, who is seeing babies often, will know the right providers to refer to for the procedure. And sometimes you may have to pay out of pocket. It may not be a provider that is covered by insurance. But what I've seen, in the area where I am, sometimes people will go for the doctor that's covered by insurance and then need to go to the professional who does this all the time, who may not take insurance afterwards, because there may not be the good results if it's not somebody that's what they call a preferred provider. Right. Preferred provider has been a term that has only been used, given by parents mostly, of people that they prefer. There's no real special list or anything like that.
Yeah.
There's lists on different groups.
Yeah.
But there's no real criteria, is what I'm trying to say.
Right. Oh. I'm reading a statement here from Jennifer. She said she goes to an IBCLC. Her daughter's 13 weeks, takes a long time to feed. She asked her IBCLC about lip tongue tie, and she said she didn't think there were ties, but to check with the pediatrician at the next checkup. Okay. I would find IBCLC who may have more experience with ties. Yeah. Is that what you would say too?
Absolutely. And obviously you asked the question on Facebook, so you're on Facebook. And there are groups. I would go into local breastfeeding groups, maybe not necessarily a tongue tie group, but a local breastfeeding group, and ask other moms, or maybe La Leche in your area might know other IBCLCs who they know are familiar. I mean, I know in my area, there are IBCLCs who refer to me because they're not as comfortable as I am. And there's other things that they're better at than me, so I'll refer back to them for other things.
Yeah.
So you network with each other, and that would be the best place to start. I wouldn't rely on the pediatrician for sure, because they just don't have the education for it.
Yep. Okay, great. Jennifer, there, you didn't ask a question, but you spoke up, so we answered you anyway.
Yeah.
We will do that. We will do that. Okay, this question came from Dawn. Dawn said, and let's just get some hearts going across the screen here. We like love and hearts. As Lisa keeps talking, keeps answering our questions, let's give her love and some hearts going across.
Give me love, so when I go on Facebook later, I can see them.
Exactly. She'll be watching this back and looking for the love. All right. So this came from Dawn. She said her 5-week-old son has a class 3 lip tie and a class 4 tongue tie, but has no problem gaining weight and not experiencing any nipple pain when feeding. He has been showing signs of silent reflux. So she was told by her pediatrician to remove dairy from her diet.
Okay.
It's been 2 weeks since the dairy was completely removed, but it hasn't helped. She has an oversupply and wondering if that could be the cause of his reflux or if the tongue tie is to blame, or possibly a combination of both.
Okay.
I don't want to do the revision if my oversupply is causing the problem, though would not revising a class 4 tongue tie cause speech problems later in life?
Right. That's a great question. First of all, I never, ever, ever will predict if a baby's going to have speech problems. Just say that babies that older kids who have speech problems are often found to have tongue ties, but that doesn't mean that every baby with a tongue tie is going to have any other problems. But I would think about what's going on right now. So when a baby can't lift its tongue all the way up, right, and it can't make the right seal, air is taken in when they feed. Right? My motions don't really work here. I'm trying.
We get it.
I'm Italian. I talk with my hands. I can't help it. It's very hard on Facebook. So the air coming in, it's called aerophagia, swallowing air. And just think about the whole digestive system as it's a tube that starts in the mouth and ends in the butt, right? And when you swallow air, it's got to go somewhere. So sometimes it'll stop high up and come back up as air. Sometimes it causes babies to be really gassy. Some babies have very explosive and difficult poops, right, from the air. So, and I've also seen a lot of green poop from air swallowing. That has nothing to do with intolerances. We remove dairy and it's still the same. So I would say it definitely is related. And there's actually a study that was done by Dr. Scott Siegel, who is a dentist who revises tongue ties by laser. And he's been doing this forever. And he's done thousands of them. And he did a study about how aerophagia related to tongue tie can be reversed with the procedure. So he actually, it was 52% of babies that had a tongue tie revised had resolution of symptoms of reflux after it was released. So that's more than half got off medication if they were on medication and had much less symptoms. And then there was an additional group that stayed on the medication but still were doing better. And there was only about 10%, don't quote me on the numbers, it's around there, that had no change at all. Right. So in my opinion, it's definitely worth looking into. The other thing is the baby is how old? 13 weeks?
5 weeks.
5 weeks. Okay. Yeah. So it's early still. And what I see is oversupply can quickly become low milk supply.
Yeah.
So I see a lot of moms, and maybe you see this too, Shari, that in the beginning they have oversupply because, and it's almost like a gift because the baby can't really stimulate the breast by moving the tongue.
Right.
So they just have to like drink from the hose. And
right.
It's wonderful that can happen and save the breastfeeding relationship. But once that slows down, when the hormones from pregnancy calm down and baby's got to work for the milk, if he can't, then the milk supply starts to drop. And I see that anywhere between 3 and 5 months, usually around 4 months. Yeah. And I meet a lot of moms at 4 months because of milk supply.
I agree. I see this a lot. It comes in, where there is a tie, but don't have any problems necessarily from it because there is plenty of milk and there's no issue with supply, there's no pain. And when you have an oversupply like that, I would expect that you may not be having nipple pain because, like Lisa said, the baby's drinking from the hose. There isn't a really good suck. Right. They don't really need to suck. They're kind of putting their mouth there and opening wide and or as wide as they can, right?
And I wonder if that baby's doing a lot of popping on and off too. That would be something that would be a sign of the popping very, very easily on and off the breast, not keeping on. Yeah. And noisy feeding. And what I would recommend just for that, and just talking about oversupply, I'm not a fan of block feeding. I like laid back position. Make sure the baby's higher than you when you're feeding, so that the gravity isn't working against the baby. So the baby's got some control. Yeah. So absolutely. I would definitely look into it. I would definitely get another evaluation to see evaluation.
Yeah. And I think when she said possibly a combination of both, I think everything's interrelated. I think that all of it is related to each other, but it doesn't exclude one issue being a problem that could be an ongoing problem or change the problem completely, where you go from oversupply, like you said, to a decreased supply and going, well, what happened? What happened to milk?
Right.
All right. Awesome. Let's see. Kim Kate was saying that she's nursing, so she can't ask her question right now. Okay. I'm going to still give her time. Kim, I promise I'm going to come back to your question, but I want you to be able to jump in when you're done.
She's going to try and come on the video?
She's going to try to come on the video. So I'm going to give her still some time to come on and ask her question live. But right now I'm going to move on to this question came from Disa, and she's asking this question, I think, as a professional. She didn't say what she does, but she said, would like strategies for handling a situation where a provider says no oral issues would like strategies for handling a situation where a provider says no oral issues and or issues won't interfere with breastfeeding when tethered oral tissues are noticeably observable. How to dance the careful dance of respecting the physician's statements while still making sure mama's and baby's needs are met.
Okay. It sounds like she's a nurse.
It does sound.
Nurses in the hospital have a hard time with this because there are some hospitals that give gag orders from nurses to talk about this. And that's just ignorant on the hospital's part, but whatever. So I would say just supplying the parent with as much information as possible without getting in trouble, if that's the case. If you're an IBCLC and you recognize something and the parent says no, but the pediatrician said there's none, I usually say, to the parent, well, what is your pediatrician's plan for helping you with breastfeeding? Because breastfeeding isn't working. And myself as a breastfeeding professional can't figure out anything else that's wrong other than what I see in the lack of tongue mobility. So that's why, that's a little bit about turning it back to, well, what's their plan other than maybe saying give, supplements. The other thing that I would say is that, very early on, you learn as a parent, hopefully, to be empowered and realize that the pediatrician is not in charge of you or your baby, right? Like they're great. Baby's sick. You have a health problem. You need guidance in medical matters. The pediatrician is the expert, but you know what's best for your baby. So if you're seeing something that's not right for your baby and the pediatrician isn't noticing it, whether it be tongue tie or anything. Yeah. God forbid you feel like your baby's not breathing right. You go to a pediatrician and the pediatrician's like, no, I think it's fine. And you feel like something's not right, then you go to the ER that night, right? So just don't, first of all, that's not the only pediatrician in town, I'm sure. And you should you should expect to have a pediatrician that will respect you. Yeah. And if not, then you can either move on or educate the pediatrician. Yeah. I have a lot of my moms will bring the information that I give them to their pediatrician, and hopefully they'll start to learn. Yeah. So. Well, I think Adisa just commented that she's a CLC. Okay, thank you. Yeah. So I think one thing that you can do if you're
if you have any kind of clients, or if you're a nurse, or if you're a CLC and you want to get that information, one great way now is to refer them to my group, or to Lisa, to Lisa's page, so that they could get the information. It's a great way for them to do more exploration, get some support from either of us and the chats that we have. So this is a great place to send clients. And then also just for the moms out there, just to kind of back up what Lisa was saying, I think so often we forget that we do have instincts, and we do have our gut feelings as parents, as moms. The pediatrician's answer is not the end all on everything, and you need to go with that gut feeling. I went to several pediatricians when my children were little, and I got different answers from different ones. And so there you go. Like, how could they all have different answers if one is the right answer? You go till you find till you're comfortable. And if you're not comfortable with the pediatrician's responses, you need to be, because you need to trust the one you're working with. It's a partnership.
Absolutely. And who works for one parent may not work for the family down the block, right? So you have to find the perfect, the good fit that you feel comfortable with.
Yeah.
I think I tried 6 or 7. So.
Yeah. I did. I think I had 4. I think I had 4. Yeah. And unfortunately, my pediatrician just passed away. Just a few months ago, and I heard about it because the girls aren't going there right now, and I just felt so sad because he helped me through so much when they were little. I relied on him so much, and it took us a while to find the right one. But when I did, Dr. Schlachter was the best, and so just thinking about him right now as I was saying that, and I miss him. And I thank God for him because he was great. Anyway, okay, let's see here. Next question. And Dawn said thank you, by the way. She that was the question before, and she did say that her baby is popping on and off.
Yeah, that's a definite sign.
Okay, so next question came from, are you guys having trouble getting the link, Joe? Oh, it says when?
But I just changed.
Okay, all right. So sorry, we are trying to get some technical things worked out here. If you want to enter to win the breast support pillow, and that's this little pillow that supports the breast. It's by the way, this is one of my favorite products. I've been selling this. I sold it in my store, and I've been working with it for so many years, and it just works so great because it prevents moms from having to hold their breast. That's what we're giving away today. And then also Lisa's handout that is on her website. If you want the link, type the word TOTS here in the chat, okay? And then follow the instructions. Joe just fixed it for me because I think I had it kind of screwed up. When you go to type it, you have to type TOTS again. Right, Joe? Is it good now?
It should work now.
Okay, good. So it should be working. It'll work anyway because he fixed it. So just type TOTS, okay, and then you will get both entry into the giveaway and also Lisa's handout, which is very valuable. Please make sure you sign up there.
And if anybody has problems getting the handout, you can always just come to my website, and the link is there.
Great.
That's always up there.
Yep. And I also have Lisa tagged in this post here too for Facebook. Great. So you can just find Lisa that way as well. Okay, yes. All right. So next question came from Amber. Amber said, my daughter had a lip tie. She got used to using a nipple shield. She's now almost 7 months and only nurses with it. She can't seem to latch without it and gets mad. Is there anything I can do to transition away from using it?
That's a tricky one. But again, back to lip tie, but was there a tongue tie? And maybe there was an undiscovered tongue tie, and that might be the issue. But I think that some babies, especially babies who were introduced to the shields early on, first of all, if it's working and everything is okay, other than it being an annoyance, baby is gaining, peeing, pooping, everything else is good, milk supply is good. There's really no harm in keeping the use of the nipple shield, except that it's something,
it's an extra
something
thing
to use, whatever. But you could try while feedings where she's not really that hungry, or if she's sleepy, or maybe halfway through the feeding, try taking it off, especially in those sleepy feedings, sometimes at night. And once the baby can latch without it, they usually get used to it again. It's usually a pretty quick transition.
And then they don't care.
Yeah, but if not, I wouldn't stress on that per se, but I would definitely have the baby evaluated. Look at my handout, look for the signs of tongue and lip tie, and make sure there's no tongue tie with that lip tie. I think we see the lip tie, and we have some pictures, I think, too. Lip ties you can see so obviously, and tongue ties are usually a little bit more insidious, a little bit harder for people to see.
I'm going to pull up some of the pictures right here so we can see them.
I'm just thinking this hour is going so fast, Shari.
It always happens like that.
And we have so many questions.
All right, this is lip tie, right? I can't see good. Is that the one? Is that the before?
I'm going to put my glasses on for just a second. Let's see. Yeah, that's a nice picture of a lip tie. And you see all the tension in that between the two fingers and up. That lip is all white, and that's a lip tie. Absolutely. Okay. And now if you look down at the tongue in this picture, it's on the bottom of the mouth. So babies whose mouths are open, their tongue should come up. Right? And so there's a little hint there that why isn't that tongue moving? It's down and back when you're lifting up, when you're opening the mouth. So that's another sign too.
And there we have a picture of the.
Okay. This is a posterior.
Wait, that's the revision.
Yeah. So the picture that we just saw, this is the exact same baby right after or this looks about 2 days after the revision. And you can see that's the scar that happens. It looks like a little diamond. It could be yellowish. And now you still see tension in the lip. So a lot of things that we have to do afterwards involve exercises and things, and maybe some body work to tighten up the tension. I don't know if we have questions about that. Won't go into it, but you still see that tension there, which is important to note. It's not just about releasing that little piece there. And this is a posterior tie. So this picture I like because this is something that parents can see. See the cupping. See, the baby's mouth is open and the tongue isn't either coming forward or going up. When you put pressure on the chin, we'd like the tongue to come up to the top of the mouth, which shows that it's got sufficient movement for breastfeeding and for talking and for all the other things we do with our tongue. So that baby's definitely restricted, but it's hard to see a tie. So let's go. We have other pictures that we'll see more. Yeah. No, the other way. So this is an anterior tie. This even your pediatrician should find. So not only is it not lifting, but there's actually that piece of tissue really in front of the tongue, and it's attached really close to behind the gum line. So this baby almost can't move and is really almost, see how little the mouth is open. The baby's having a hard time. I doubt this baby can nurse very well.
Right. Amy's asking if she wants to join live. Joe, can you just post up the link again? I'm going to just put it here real quick. Hold on. Amy, this is how you can join live. Go to this link right here, bit.ly/live to 62918. Just make sure it's all case sensitive, okay? And then you can, what?
It's not allowing me to edit the post.
Oh, okay. All right, so that's how you get to the live. All right. Let's see.
Okay, so now this is that posterior tie that we saw before when the baby's mouth was open. This is what it looks like when I examined the baby. So that's the same. From the outside, it looks like there's no restriction. The tongue is just stuck down. But when you lift up, you can see that attachment underneath. And look at all the tension in that baby's face, that blanching, that yellow. Is all tightness. So this baby's having a hard time. Yeah,
definitely. You could really see the tension in the face there. Yeah. And then there was one more I think we didn't see, which is here.
Oh, this is a buccal tie. So I don't know if anybody's heard of buccal ties. We're just starting to look at this in the last few years, or myself and the people that I work with. Yeah. Really hard to see, but it's inside the upper gum. There's that little piece of tissue. I don't have a pointer. I don't know.
I know, and I can't use. But it's right
near. I'm pointing to the screen, but you can't see me pointing. It's really awkward.
That's what I would do.
Right next to where my finger is in the baby's mouth. If you look really closely, you can see like a little webbing that attaches the gum to the inside of the cheek. From the outside, sometimes that looks like a cute dimple. but it's really a restriction. And how do you know it's a restriction? Because of the blanching and the tightness that are there. And the baby then is having a hard time opening their mouth wide.
So there's tongue, there's lip, and there's buccal, which is on the side of the mouths, right? So those are all the places where they can have those restrictions.
Yeah. And again, not all of them cause problems.
Right.
And frenums are normal. So the attachments are called frenums, and frenums are normal. It's just that when they're restricting movement, they're abnormal.
Yep. Great pictures. Okay. Let me just get rid of that. Okay. So hopefully you guys got that link if you want to jump in here. Let's talk a little bit about the body work. I'm wondering if there's a question about it. I think
I saw something about somebody posted something about just body work. First question. So I'll just talk a little bit about
go ahead.
So body work. When we say body work, we mean chiropractic.
Oh, that was Kim. Kim asked.
Okay.
Yeah,
either chiropractic or craniosacral therapy or an occupational therapist who understands this issue. There's all different modalities. The object of the game is to release tensions in the body. So sometimes it could appear that the tongue is restricted. The tongue doesn't work as it needs to work for breastfeeding, but it's just because there's tension coming from elsewhere. So maybe in the neck or the head or the shoulders. Birth is not an easy experience for these babies, right?
No.
So we want to loosen them up. And from an unprofessional point of view, I always say we want to help the babies uncurl. I'm not a body worker, but babies are born all curled up. And we want to help them uncurl and be able to lift their neck and shoulders. And that, if you think about lifting the neck, if there was a restriction and it was tight, it'd be pulled back and it would be pulling back the tongue. When you release it, the tongue can move better.
Yeah.
So I always advise that before thinking about sending to the provider for the procedure.
This is a huge point.
Emergency.
This is a huge point.
Right.
This is a huge point that, I think people don't think about. They think they'll just get the revision done. That'll fix everything. And then they're disappointed that there's still pain. There's still issues. The baby still can't latch or suck. And at least the point you're making is that the body work actually needs to be done before the procedure.
Yes. Unless the baby, it's such a point where the baby can't nurse at all. There are some emergency assessments that I make that say this baby's not nursing, or baby can nurse and mom's in so much pain that she can't even have the baby there. I'm sure there's moms in this group today that have had that experience. Yeah. They really want to nurse their baby, but it's just too painful. Yeah. So, there are times when I'll say, all right, you know what, go get it done and then we'll worry about the body work. Yeah. But it's one piece of the puzzle. And those of us that work with these babies, we say it's a three-legged stool. It's the provider, the IBCLC for assessment, and the body worker. And we work together as a team. I like to consider the IBCLC as the team leader because we're the ones that can assess how the function is and then referring back and forth to the different providers. And as I'm talking, I'm thinking back to the question we had before about how to find a provider. Yeah. If you say to the provider, I heard that body work is a good idea, and they say something negative, then that's not the provider you want to go to.
There's a good question, interview question for you, right? Yeah. Good interview question. Yep. I agree with that. When they're already from the beginning, like, nah, you don't, that's not necessary. You already know. Yeah.
And you know what? One of the tools that I've been thinking about developing, like giving out as a free handout, is what to ask your provider.
That'd be a great tool.
I love hearts about that. If anybody thinks about that, how to find a provider and what to look for and what to ask.
Would you guys like that? Let's get some thumbs going, hearts going if you like that. I think that would be great because I think that way too many parents show up in these offices. They don't know what to ask. They're not the expert. Right. And, they're kind of like, okay, did we need it? Did we not need it? How do you figure out if this is the right provider for you? Right. And we've done, we've done two questions and tips on how to choose the pediatrician, but how do you choose someone to have this kind of
specialist?
Specialist. Yeah. I think that would be great.
If I'm working to develop things that are going to help parents, which is my goal, I love the feedback. Yeah. Because, my mission is to help as many moms and babies as I can. And it's hard to do that in one little office. So that's why I'm, trying to get an online thing going.
Totally.
And so, but the feedback is helpful because I really, I don't really know. I just know what I hear.
Yeah, absolutely.
So the feedback
Absolutely.
is wonderful. I'll give you what you need.
Right? I think that anything that supports them from the beginning to the end of the process, anything that helps them, identify what are the issues and how do you even think about maybe this may be a problem for me or my baby, how to find the right person, how to do the proper follow-up care, how to do the other care, the body work, Lisa, I think that this is something they're not getting everywhere. Yeah. So it is really, really important.
It'll reach a lot of people.
Yeah. And if anybody wants to jump in, ask their question live, we still have time for that. So we're waiting to see who wants to jump in and get a live question with us. And then I'm going to go back to Kim's question because obviously she's nursing her baby and we're not going to make her wait anymore. We're going to answer that for her. Poor Kim. Okay. So Kim, your question was she's a 6-day-old. Well, there you go. Okay.
Congratulations.
I wish I would have read that earlier. I would have said, no bother, just let us answer your question.
Right.
Her 6-day-old was just diagnosed with a posterior tongue tie today. The LC that they saw suggested it cannot be treated with a laser, but instead suggested craniosacral therapy.
Okay.
Can you share your thoughts on this and how it works, what to look out for, and how posterior tie could impact him with eating and speech? The baby is gaining well as her oversupply is compensating for latch difficulties. However, she's dealing with cracked and bleeding nipples no matter how hard I work on his latch. The LC said he's a chewer, not a sucker. Thank you so much.
Oh, Kim, I'm so sorry that you're going through this. And I would, LC, is that an IBCLC? That would be the first thing I would say. And I would find somebody else or go, if she was able to say it's a posterior tie, then I would maybe find someone in your area. If you have trouble finding somebody, either a provider, a dentist, or you could post and I can always find someone in areas through my professional networks to suggest to you. That's the symptom. I mean, if the baby can't nurse, it shouldn't hurt to nurse your baby.
And you shouldn't be bleeding at 6 days postpartum.
No, you should not be bleeding. That's not normal. Breastfeeding is a normal function, a biological imperative for survival. It shouldn't hurt. It shouldn't cause bleeding. Absolutely. And you may want to get something for your nipples. Like I would reach out for somebody for nipple care too.
Absolutely.
If you haven't.
Absolutely. Well, congratulations, Kim, on your baby
and
here.
And it gets easier, Kim.
It really does. It really does. If you guys haven't joined my private Facebook group, I really want you to do that. That's My Baby Experts community. And Joe put it up here for all of you. It's also in the link that you got sent. What, Joe?
Yeah, I can go to TOTS.
Oh, yeah. If you just type TOTS here, it's going to give you the message, and there'll be a link to my group. There'll be a link to Lisa's website for the handout, and also to win the breast support pillow today. Okay, so if you haven't joined, please come join us right here on my pages. If you just click the button at the top of my Facebook page, it says Join Group. I think it says Join Group. It's that simple. You can just join. What?
Who's in the group?
Who's in the group? Joe wants to know. We're asking, who's in the group? Are you part of my private group? I'd love to hear from you. Just say yes here. Let us know who's here from our group. We're streaming into the group as well today, so I think people are here from there. I saw a question. Oh, Brenda here in the chat. She said, here's her question. Don't you love this? Look at that. Isn't that cute?
Oh, the question's up there.
Yeah. Is there a way you can prevent tongue tie?
Probably not. We don't really know enough about it. There are some theories that it's an epigenetic change that may have something to do with the MTHFR mutation, which is a gene mutation. Now, that's a lot of medical mumbo jumbo, but basically we want, to prevent any kind of oral defects, any kind of midline defects, which the tongue and lip tie is make sure you're getting good folate, not necessarily folic acid.
Mm-hmm.
So folate in natural form, lots of green leafy vegetables,
Mm-hmm.
eating a whole clean diet as much as you can,
Mm-hmm.
organic food,
Mm-hmm.
just eat well during pregnancy.
Mm-hmm.
But there may not be anything that you can do. Like, I don't want anybody to think, well, I did something that caused this.
Yeah.
There may or may not be. There's research being done. There's research that needs to be done. It's a fascinating topic.
Mm-hmm.
But right now, we don't really know for sure. And you may hear myths and ideas and people that are definitely saying, if you do this, then that. But there's no definite tie, no pun intended,
Yeah.
from MTHFR mutation to lip and tongue tie.
Mm-hmm.
There's associations, but there's no causation.
And I would say that even if we don't have the full evidence because we haven't seen the research, because sometimes it's just a lack of research. It's not that it's been proven not to. It's just that we haven't proven it to be correlation. There's such a large majority, such a large portion of the population is MTHFR.
Right.
Has that gene mutation.
Right.
And we do know that folic acid will interfere with the body's ability to absorb folate. And so even if you eat the folate and you've taken all this folic acid, your body can't absorb the folate, which it needs.
Right.
So, a lot of the prenatal vitamins that moms are on have folic acid.
Folic acid, yeah. And some people are just taking plain folic acid because their doctors are doing it.
Right.
And the other thing that, not to interrupt you, but processed foods have folic acid added, which, when it happened, the government thought they were doing a wonderful thing. Yeah. But now we know that they're not, and it should be taken out. But processed cereals, wet breads, lots of things.
It's in so many things. It's in so many things. And it's really, I would just say that because unless you're going to get tested and you're going to test yourself for MTHFR, I would just try to avoid the folic acid as much as possible. But that doesn't mean you don't take anything. You need to replace that with folate, whether it's green leafy vegetables, eating enough of that, or supplementation that is folate versus methylfolate instead of folic acid.
Absolutely.
We could do a whole show just about that.
Oh, yeah.
I see Amy's trying to get into the stream, but I don't see her camera on. So she needs to turn on her camera. I don't think she could come on without it. Let me see here if I can bring her on without the camera. Is she on? Let's see. Yeah, I don't think so. Yep, no camera, Amy. I don't know. We'll bring you back as soon as you have your camera on. All right, so someone's trying to ask a question. All right, let's keep going here. Great questions, you guys. You're amazing. You're amazing. And yes, I see all of you from my group. I'm so happy that you're enjoying it. And I'm just blown away with all of your interaction and all of your support for each other. You guys have amazing information to offer each other and support, and you've been doing that. And it's exactly what I had in mind for this private group, was really creating a community where you can help each other, where you can have access to great content, from my library and from all the live streams. And we're about to start our private Q&As, our private live streams there into the group. So if you're not a member, make sure you join because you don't want to miss anything. We're going to do some great stuff together. So we're going to start that. Oh, there's Amy. Okay, Amy, I'm bringing you in. She got her camera working.
Yay.
Yay. Okay, here's Amy. Hi.
Hi, Amy.
My baby's right here. She's sleeping.
Aww.
She
Fantastic. I'm glad you got on. I was like, wait, doesn't have the camera on. Turn on the camera.
It's been going weird. It's been trying to go in and out. So I'll be quick. She's 4 months old. And when we were in the hospital, she was revised. I think she had an anterior tie. It was clearly, but I'm not sure if maybe they didn't do maybe she had a posterior, wasn't done away, or maybe it reattached. I'm not having any issues with breastfeeding right now. I've been working with an IBCLC. But I'm just wondering, at what point should I decide if I should try to check it again, and if we should maybe be revised, try to make it revised if it could cause problems? I'm just not sure.
That's a great question. And, your experience is very common because, the hospitals that are starting to recognize tongue tie, especially anterior tie, usually have somebody there that is comfortable with releasing the anterior and doesn't go beyond that. So if there's no functional problems, and I would download my handout, look at the signs and symptoms, because a lot of times people don't realize, they're like, oh yeah, that happens. I didn't know that could be a sign, right? So look at all the signs and symptoms. Keep that in the back of your mind, and then decide based on that, and it's never too late. But if your child starts developing issues older, then don't wait until adulthood. Like me, I had a tongue tie, and I wish it was released when I was older because it caused me airway issues, right? So, I would say think of the long-term consequences and decide as a parent if you think it's something to do. But I would definitely, look at the signs and symptoms and make sure that everything is really okay with breastfeeding. I've had some moms in my office that say, oh yeah, breastfeeding's fine. Oh yes, my nipples hurt and they bleed sometimes, but breastfeeding's fine, right? So we take a lot of stuff as moms, as parents, we put up with a lot of stuff as normal, which it doesn't have to be. So make sure everything is truly, truly working for both of you, and keep an eye on your milk supply. Keep a close eye.
I feel like I have a pretty good milk supply, and she's gaining weight well, and plenty of
keep an eye on it. Don't go more than a month between weights.
Okay.
Right. Just to be sure. All right. Great question, though.
Awesome. Good to see you, Amy.
And I'm glad you made it on.
Yeah.
Thanks.
Have a good one. Happy Friday. Okay, bye.
Happy Friday.
Bye.
Happy Friday.
Awesome. Yay. We'd love to see moms and babies. It's great for sure that you could get on with us. And I just wanted to circle back to the whole idea of reattachment and stretches. There was another question that came in from Ilana. She said, I just got my daughter's lip tie clipped. How can I tell if it's reattaching? I'm doing the stretches, but probably not as frequently as I should.
Okay. That's a good question too. So, the stretches are to keep that wound open as long as possible. So I think that the way to know if you're doing it properly and if there's reattachment would be, are the symptoms that you were trying to alleviate, the symptoms that were bothering you that sent you to have it fixed, are they there again? If they were there again or never went away, then I'd say something's not right. And again, that's another lip, not tongue. It's really curious that we've had that many.
I was just gonna bring that up.
So I would definitely get somebody to look under.
How common is it to? I mean, my understanding was that it's very uncommon to just have a lip and not a tongue tie. So
I've
we're seeing
only
all these
seen like 2 or 3, and I've been looking at tongue ties for over 5 years.
Yeah.
So it's very rare.
So probably just misdiagnosed posterior ties that really are there, and they're just doing the lip, then things are not really getting much better. And in this case, it might not be a reattachment at all. It just might be that it was never completely done.
Right. Or, I don't find that lips reattach much. There's always the frenum. So the frenum may grow back a little bit, but if the function is better, then it's not restricted again, then there's no problem.
Right.
So it goes back to the symptoms. So I would definitely get somebody to evaluate that understands about posterior tongue tie. Look at the symptoms. Again, look at my symptom sheet and see if you have the symptoms that are on there. And if you had them before and they're better after, then maybe it was just a lip tie and things are better.
Yep.
But if there's still symptoms or there were symptoms relieved and then they came back, then I would be evaluated again.
Yeah.
And then always go back to the person you went to. If you went to an LC, I know if somebody came to me and they had problems afterwards, I'd want them to come back to me before they went to someone else. Give that person the benefit of the doubt, even if it's just to teach them. That's how I kind of learned. Yeah. Right. The LC will be learning along with you about what else could be going on.
Totally. And good practitioners always want to keep learning.
Yes.
Right?
Absolutely.
They always want to keep learning.
If I could be pressing my thumbs up.
Absolutely. Yeah. Absolutely. Oh, great. Is it okay to ask a few more questions, Lisa? Or are you in a hurry? Okay. Couple more questions.
5 minutes.
I wanted to say that Addie just commented here. And it's a big question, so I'll probably cover her face. She said, I just want to say that even those pumping and bottle feeding mommies can be impacted too, not just feeding at the breast directly. Good point. Such a good point. because somehow we think that if you're having trouble breastfeeding because of these ties, that the answer will be to just stop breastfeeding, and that somehow nothing else matters, and that it's not going to impact anything else. And as Lisa's been describing throughout the whole program about feeding issues, speech issues, airway issues, but also sucking on bottles as well. And so those babies will still have trouble, a
lot of reflux too.
A lot of reflux. So it's a good point, Addie. It's not just breastfeeding.
Thanks for bringing these lactation consultants back to the basics.
Yeah, exactly. Thank you for reminding us.
Thank you.
Gretchen asks, can lip ties increase the likelihood of mastitis?
Yes.
Mm-hmm.
Absolutely.
Yeah.
Because the way the baby's attaching to the breast may not be even, or may be putting pressure in a certain place, or may not be emptying the breast completely. And it's also more stressful for mom, and stress causes mastitis. In my opinion, stress and exhaustion is the biggest cause of mastitis in moms. So, absolutely.
Yeah.
That was an easy one.
Anything that's going to cause that stress, anxiety, and also the difficulty with emptying the breast. So, and so these ties can definitely make it hard for the baby to empty the breast. It can also cause the cracking and the bleeding that we were talking about earlier, which then allows for bacteria to enter. So you just have a combination of all these things that can happen from it. And yes, it can cause mastitis, which then, can make you very sick, and also decrease drive your milk, and all these other things. So it's a baby problem and a mommy problem.
Absolutely.
It's both. This person, let's see. Do we have anything else in the chat here? I just want to make sure that you all have access to the handout.
And if anybody, if we missed any questions, I'll go there and answer,
Yeah, there's a few more questions. There's one, Caitlin asked the question, I believe my daughter has a lip tie, but I'm not sure how to tell if she has one.
I would go by the symptom list, back to looking at the symptoms.
Yeah. Back to the symptoms, and then just to explain what are when you're using the word function, a diagnosis of function, and I want to make sure that they understand what that means, so that it's clear, because sometimes you and I can talk about things and they're like, what do you mean by that?
So function, meaning like the function of the lip and the tongue for breastfeeding, is a good latch that doesn't cause mom pain, that can move freely, that effectively works on the breast. So if any of those are the functions that we're talking about as a breastfeeding baby. As the child gets older, it may be a bottle feeder. It may be a sippy cup problem. I know a lot of babies, not even in my practice, but older babies whose moms, all of a sudden the baby's not breastfeeding, but they have trouble with certain textures. So the tongue can't move around. The function of the tongue is to help the baby chew and swallow different textures, to help us chew and swallow too. So that's another function. So the way the tongue works and the way the lip works in breastfeeding is the function. Does that make sense?
Yeah, absolutely. Yeah. Thank you for clarifying that.
Welcome.
And I'm going to give one more question to the last person who posted it here, and then we'll be done for the day. Here we go. This is from Colleen. How can you tell if it is healing properly? I had my son's lip tie cut on Tuesday.
Okay, so the best person to tell you what to look for is actually the person who did the procedure, because depending on whether it was a scissor release or a laser, or some people use cautery, there's different ways that it will look as it heals. But it should start out it should be a diamond shape, and sometimes it'll be white at first, and then it may get yellow, but it should stay in the diamond shape and gradually shrink and heal over. Sometimes it gets a little funky looking. But as long as there's no odor and the baby seems to be nursing, that would be a sign that it's healing properly.
Awesome. So I just want to say that if you had any trouble with the message today, with the TOTS message, if you didn't get the link, don't worry. Right when we're done with this chat, if you just go right into the post that's here from the live stream, there's actually a link you could click on that will send you the message directly. Okay, so there's two ways to get it. You could click on the link here in the post, or you can just type the word TOTS and then follow the instructions and you should get them. All right. And if you still don't get it, come into the private group. Let me know. I'll be posting the link there in my group as well. So you will all get Lisa's handout. You will all get entries into the giveaway. And hopefully you'll all join me over at the My Baby Experts community, and we're going to have some fun together. Lisa, thank you so much. See how fast this went? We don't even want to be done, right?
This was so much fun. I'll come back any Friday.
Oh, okay. Well, you know what? Be careful what you say. We may take you up on that.
And thanks. I was so impressed with everybody's questions. Everybody had such great questions and
they're
comments.
amazing. Aren't they amazing?
Yeah.
I just get the honor to work with the best people. I love you all so much, and I'm so happy to have you here. And Lisa, thank you for being with us.
You're welcome.
Thank you, Anita.
Thank you for having me.
Anita from Breast Support Pillow. I see you here in the chat, sweetheart. Love, love, love you and love your product. So everybody go give some love to Breast Support Pillow. Click over and visit her on Facebook. Go see her product. Go watch her short little videos. It's great, and it's really a very, very helpful product, okay? So everybody have a wonderful, wonderful weekend. We will be back on Wednesday afternoon. It is our first breast sleeping Q&A of the summer, really. I guess July would be the summer. The first one in July, at the very least. And I'll be here with Rebecca Mickey, children's sleep consultant, to do our amazing breast sleeping Q&A this Wednesday at 1 p.m. Eastern, okay? Love you guys. Have a wonderful weekend. Mwah!
Bye.
Bye. Bye.